Good afternoon, everybody. It's once again Ted the Speed Learner, and I am talking about the healthcare bill once again. This is going to be part number 22, and there are going to be lots of parts to this, so don't think you're going to be able to do this in one shot, okay? Now, I was talking about Section 223A, and I'm sorry, Section 223, letter C, Part 2 of the Internal Revenue Code of 1986. And I'm going to read this to you a little bit slower this time than I did the last time, okay? Because I read that to you awful fast, and I wanted to read this a little bit slower. This is talking about the eligible individuals for this high-risk health insurance pool that the Secretary of Health and Human Services has concocted, okay? Such individual is not, while covered under a high-deductible health plan. He is now covered under a high-deductible health plan, okay? Such individual is not covered under any other health plan which is not a high-deductible health plan, okay? Now, let me try to explain that just a little bit better. Now, let me say that again. Such individual is not covered under any health plan which is not a high-deductible health plan. Okay, so if he has a health plan that is something other than a high-deductible health plan, then he can't be covered by this. Okay. Now, if he is covered under a program, now this was the second part, such individual is not covered under any health plan which provides coverage for any benefit which is covered under the high deductible plan. Now, boy, that's a load of words right there. Okay, so if he's covered under another plan that covers a benefit that is supposed to be covered by this high deductible plan, then he's not an eligible member for this high deductible plan. He's ineligible to be a part of the high deductible plan if his other plan covers a benefit that this high deductible plan also covers. That makes him ineligible. Okay. Now we can move on along. Okay, now we had an A, B, and C for this qualified high-risk pool. Okay, I talked about A and B in the last video. Now we're going to talk about Section C, and it says it ensures that with respect to the premium rate charged for health insurance coverage. Okay. Now, the premium rate is what you charge the customer for being a part of your health plan. Okay, so you're gonna charge a premium to be a part of this high-risk pool. Okay. Now, we're offering this high-risk pool to eligible individuals through this high-risk pool, except as provided in Clause 2, vary only as provided under Section 2701 of the Public Health Service Act. Now, I'm sure you guys have never heard of the Public Health Service Act. I have now pulled it up. So, we find Section 2701 of the Public Health. Let me read this again. The Public Health Service Act. Okay. The Public Health Service Act, Section 2701. All right, and now you got to bear with me because this thing is so long. I'm gonna have to kind of move my camera out of the way. Okay, Section 2701 is entitled Fair Health Insurance Premiums. Okay, and this thing is to prohibit discriminatory premium rates. Okay, and this is in respect to the premium rate charged by a health insurance issuer for health insurance coverage offered in the individual or small group market. Okay, so this would be a healthcare this would be a health insurance provided to an individual or a health insurance provided to a small group, let's say a group of like 20 employees or something like that. Okay, this rate shall vary with respect to particular plan or coverage involved only by, okay, so the rate will vary under the following conditions. Okay, And the first way it can vary is whether you're covering an individual or you're covering a whole family. So obviously the health insurance provider can charge you more for a premium if he's covering a whole family rather than just a regular individual. I'm an individual, so they can charge me one rate. But if I had a wife and kids, they could charge me another different rate. Okay. How will this also vary? In a rating area as established with paragraph 2. Okay, now this would be I live here in Illinois, so this is one area. If I lived in Kentucky, it would be a different rate. If I lived in Tennessee, it'd be a different rate. Why? Because maybe the health insurance provider runs a business in these different states, but he runs it cheaper in some states than he does in others, so he passes on that savings then to you. Alright? Now, it also will vary with age. Obviously, the health insurance provider can charge more to a senior citizen than he would try to even charge to a 20-year-old, because the 20-year-old may be healthier than the senior citizen. Okay? Generally, senior citizens are not as healthy as a 20-year-old. Okay? Now, this rate shall not vary more than 3 to 1 for adults. Okay? So, he can't charge like 5 times as much to a senior citizen as he does to a 20-year-old. Because that would just be totally unfair. I know that senior citizens are not as well as a 20-year-old, but he can't charge an exorbitant amount to a senior citizen and then charge a 20-year-old practically nothing. That wouldn't be fair. Alright? And they can have a varying rate because of tobacco use. Okay? So, because tobacco has been found to be something where it can make you unhealthy. You're going to have increased medical bills because of tobacco use. That's just a fact. And so the health insurance company, when they're trying to insure you, they can say, okay, we're going to make you pay more because you smoke and somebody else does not. And that's fair. Okay. Now, the rate varying on that would be 1.5 to 1. Okay, so they can't say, we're going to charge you $6,000 for your health insurance this year, and the non-smoker, we're going to charge him a couple $100. They can't do that. And not according to the law, they can't do that. They ought to, but they can't. Alright, according to the law, they cannot charge a smoker $6,000 and a non-smoker a couple $150. Okay. So it's not a massive amount. It's a 1.5 to 1. Okay. Such rate will not vary with respect to the particular plan coverage involved by any other factor not described in subparagraph A. Okay, we just covered subparagraph A. Now it talks about the rating area. Now this is where we find out what the rating area is all about. Each state shall establish one or more rating areas within that state for purposes of applying requirements of this title. So, if you're talking about Illinois, they may establish a rating area for Chicago area, they might establish a rating area for Central Illinois and one for Southern Illinois. Why? Because maybe they cover more people in Chicago than they do in Central Illinois. Maybe they cover more people in Central Illinois than they do in Southern Illinois, because a lot of people live in Southern Illinois. So there's going to actually be a rate difference between people who live in Central Illinois and people who live in Southern Illinois. Okay? So it might actually be cheaper to live in Southern Illinois than it would be in Central Illinois. Okay. The Secretary of Health and Human Services shall review the rating areas established by each state under subparagraph A to ensure the adequacy of such areas for purposes of carrying out the requirements of this title. If the Secretary determines that a state's rating area are not adequate or that a state does not establish such areas, the Secretary may establish rating areas for that state. So in other words, if the state, like Illinois, establishes a rating area for Chicago, a rating area for Central Illinois, and a rating area for Southern Illinois, and the Secretary of Health and Human Services is not happy with that, he can say, you're not going to do that anymore. I'll change it to what I like. And maybe he'll say, well, we'll charge more people to the west and not as much to the ones to the east. Or maybe we'll charge more to the east and not to the west. He can do that. Alright, permissible age bands. The Secretary, in consultation with the National Association of Insurance Commissioners, shall define the permissible age bands for rating purposes under paragraph 1 or whatever. Application of variations based on age or tobacco use. With respect to family coverage under a group health plan or health insurance coverage, the rating variations permitted under clauses 3 and 4 of paragraph 1, whatever, shall be applied based on the portion of the premium that is attributable to each family member covered under the plan coverage. Whew, that's a lot of words. They're just determining at this point what the rate should be between a smoker and a non-smoker, and somebody that's 20 and somebody that's 60. Okay, we have a special rule for large group markets. If a state permits health insurance issuers that offer coverage in the large group market in the state to offer such coverage through the state exchange, as provided under Section 1312F2B of the Patient Protection and Affordable Care Act, the provisions of this subsection shall apply to all coverage offered in such market other than self-insured group health plans offered in such market in the state. So again, we're talking about state exchanges. We talked about this in a previous video. Now you got it. Whew. That's a lot. Okay, so now you know all that. I will cover the rest of this, or as much as I can, in my next video, so I want you to stay tuned.